So this is a short video on what trigger point dry needling is. Trigger point dry needling is a tool that a therapist would use to work on any musculoskeletal problem. Usually does really well on the spinal issues, from headaches to cervical pain to lumbar pain, even piriformis pain and SI joint dysfunction. What a trigger point dry needling needle looks like, it's an acupuncture needle like this. They're sterilized, they're in individual compartments, and what the therapist will do, he'll take one out and it's all sealed up, and all the patient's going to feel is the actual straw or the guide for the needle. So I'm going to stick this in her upper trap on the right. Usually that's where you have a good trigger point. So by doing that, I find where I want to stick it. There's a little piece of glue holding it in. I tap it and the needle's in, and then what you do is you stick it through into the muscle and you turn it slightly to grab the myofascial tissue. And the reason you do that is the dry needle will go in there and grab the myofascial tissue, kind of like a fork sticking in spaghetti, and you just twirl it to eat it. And what that does, it makes micro trauma in the actual muscle fiber or the myofascial tissue of the muscle. And this makes your brain release opioids to heal that micro trauma done to the myofascial tissue where the needle was inserted. So that little micro trauma caused by the needle, and that will allow your body to start heal by getting the opioids down to where the muscle is injured. And then while the opioids are down there, it kind of notices, oh, there's some other stuff that we thought was normal, which is causing pain, and it kind of jump starts your body to start to heal. So it's a very good technique we use, or tool that a therapist might use. So a lot of people come in, they're say an 8 out of 10 pain-wise, and then they undergo dry needling, and on a good result, the next day they might be a 2 out of 10. They're going to be sore like they worked out, went to the gym and worked out those muscles, because those muscles are going to be worked with the stimulation I'm putting on. And that's why I'm doing the upper trap, to show you how it actually makes the muscle flex. And you want to take as much stimulation as you can take, almost to the nauseating part, just so you can get a benefit to have it the next day. And that's called De Qi. So De Qi is the Chinese name for pain before, to not have pain after. So I'm going to turn this up, and you're going to see on her upper traps how it kind of makes her twitch, makes the muscle twitch when it gets up there. And it's a kind of a weird feeling for the patient, because the patient's not contracting, but see how it goes and makes her kind of shrug her shoulders. So that's in her upper traps. And the more she takes, the better the treatment would be. So we do this for 18 to 20 minutes. Then we pull the needles and then we put a heat on it for 10 minutes. And you can do dry needling, but you have to wait 48 hours. So you do it on, say if you come on a Monday, then you do it on Wednesday, or if you come on a Tuesday, you do it on Thursday. And I recommend doing it at least 3 sessions. And by the 3rd session, if your pain isn't at least halfway gone or almost abolished, then it's not worth you doing the pain to have it, so we can switch to another treatment. But this is a real good treatment for, like I said, for headaches, for upper back problems, for spine problems. Does really good on the piriformis and the buttocks region and the SI joint for sciatica. And if you can tolerate the stimulation and the treatment, the next day you wake up sore, but a lot less pain. And a lot of people respond a lot quicker. So in 3 or 4 visits, their pain is below 3 or 4, and they were a 5 or 8 coming in. And we can see them for 2 or 3 weeks and resolve the problem a lot quicker. Thank you for watching.